LSU Health Shreveport ramping up its efforts to combat the coronavirus outbreak.
NBC6's Brad Cisak talked with Dr. G.E. Galley to talk about the hospital's latest efforts.
We've increased our capacity by 60% right off the bat of number of ICU beds that we have.
Oxnard LSU Health Shreveport is ramping up its fight against the COVID-19 pandemic.
So certainly we've ramped up our testing.
That's been done through the new evolving viral threat lab at the hospital. Before, it took almost a week to get results back, and now they can get results in less than 48 hours, freeing up some needed resources.
We can move the negative patients out of an isolation room, which makes the isolation available for the patients that actually are COVID positive. And also, if we can determine if they're negative or positive, then we would not need as much PPE or personal protective equipment.
Dr. Galley is trying to flatten the curve. One way to do that is through the phrase you've probably heard over the last few weeks: social distancing.
The governor's stay-at-home order that has been extended through the end of next month is really critical, and it follows the federal guidelines as well.
But one of the reasons why social distancing, or physical distancing as Dr. Galley calls it, is so important is because of how fast this virus can actually spread. Think of it this way: if you have one person who is infected with the virus, they can spread it to two people, who could then in turn spread it to two people of their own, and so on until this virus grows exponentially out of control.
That's why following the guidelines is so important. It buys the medical professionals some much needed time.
We're learning more and more about this virus every day, but the reality is that we know nothing about this virus compared to what we'll know about this virus 6 months or a year down the road.